Hi, I'm Dr. Oliver and I'm a pediatrician at RockPeds Pediatrics and Adolescents. We're very excited to host the vaccine clinic this Thursday, May the 20th at 4 o'clock for those patients aged 12 and over. I, along with other providers at RockPeds, definitely encourage all of our patients who haven't already to consider getting vaccinated, and those of us with kids of age are definitely going to be including them in this vaccine endeavor. After all, we've seen firsthand the impact that this pandemic has had, both indirectly and directly, on our children, and we're excited to be able to help everyone return to as close to normal as possible as soon as they can. I understand that this vaccine, along with the virus, is very new and there's going to be a lot of questions about it, so I hope to take some time today to answer some of those concerns that we've heard from parents in our clinic and others within our community. One of the most common concerns I've come across so far is regarding the fact that the vaccine approved for kids is a new type of vaccine called an mRNA vaccine. And while yes, this is a new type of vaccine, the technology used to build these vaccines is definitely not new. mRNA research has been going on for decades to study issues such as other viruses and cancers. The unique situation with the pandemic enabled lots of resources such as funding and research volunteers to be dedicated to this cause much more quickly than is typical for other vaccine development. And this helped researchers and developers demonstrate its safety and efficacy and get it out to the public as soon as possible. Also, regarding mRNA vaccines, there have been a lot of concerns expressed to us that this may somehow interact with your DNA or genetics, and this is not the case at all. The mRNA molecule never enters the nucleus or interacts with any of your genes. It's used to help the cells develop a protein similar to what is seen on the coronavirus. The body will then recognize that this is a new potential invader and it will learn to fight it. The mRNA molecule is destroyed within a few days, just like all mRNA molecules are within your body, and leaving your immune system with the knowledge of how to fight the coronavirus should it encounter it again. No interaction with your DNA or genes is needed. With this being a new vaccine, there's also been some concerns about how could we possibly know that it's safe to give to children with so little time to gather data. It is true that the study included about 2,200 children ages 12 to 17, about half of which received the vaccine and the other received a placebo. In the world of research, this is definitely a smaller number, but the data they've gathered has been overwhelmingly positive at this point. So far, as it stands now, 0 patients who received the vaccine in this study have contracted the coronavirus. Also, these patients have been shown to develop a stronger response either those who contracted the virus naturally or the adult counterparts who also received the vaccine. As far as side effects go, they've been very mild, and in the research so far has been nearly identical to what has been shown in the adult population, which has definitely been a much larger study. They mostly included pain at the injection site, chills, fatigue, fever, headache, flu-like symptoms. And while these might be slightly uncomfortable, they are definitely a sign that your immune system is doing what it needs to do to fight off this virus. All of the providers at RockPeds are happy to discuss any additional questions or concerns you might have regarding either the coronavirus in children or regarding this vaccine. Studies are definitely ongoing and much more data will be available once more children are able to receive this vaccine, and we are going to work diligently at staying up to date with all the new data as it becomes available. We're very happy to help our patients play a role in fighting this pandemic and help our kids get back to as close to normal as they knew prior to the pandemic starting. Again, the clinic will be held May the 20th, starting at 4 o'clock. Please call 606-256-7767 to pre-register.